Okay, so hello students. Fine. Am I visible and audible to all of you? We'll start. Good evening, good evening, good evening to all of you. Good evening. Hello. Now, some things about histology, just the identifying characteristics of the slide. Like if a slide comes, what do you know to identify that as a particular slide? What characteristics are expected from you in the exams? And suppose if a short note comes, you can write this characteristic, you can draw a good diagram with H and D pencil, and that much would suffice. Okay, fine. So let us start. So starting with this histology, can anyone identify this slide? Come on, what is this slide of? So I'll put the slides. If you can try to identify this. Good evening, bacho. Good evening to all of you. If you can identify, just try to identify the slide, then we'll come to it. Okay, any guesses? Anyone? What is the slide of? Okay, so the moment I look into the slide, the moment I look into the microscope, I find such rounded structures. Look at this. I find such rounded structures. What are these rounded structures known as? This are known as the acinus. Acinus. So this is the acinus. Yes. Does anything come to your mind now? What could this slide be? If I'm telling you this are the acinus. Yes, Ritvi. Acinus are of two types. एक होता है serous acinus, एक होता है mucous acinus. We'll come to this. So if there are plenty of serous acinus, that gland is a serous salivary gland. If there are plenty of mucous acinus, that gland is a mucous salivary gland. And if both serous and mucous acinus are seen, that's a mixed gland. Okay, so this is a very important slide. Okay, so what is an acinus? One basic question which is always asked in the exams: define an acinus. So acinus is a group of secretory cells which enclose a lumen, right? So it's a group of secretory cells. If I draw it like this, these are tall and columnar cells or cuboidal cells. So group of secretory cells enclosing a lumen is known as an acinus, right? Very good, very good. So now there are two types of acinus. Let me just tell you this. There are two types of acinus. One is this and the other one in which the cells are cuboidal like this. The cells are cuboidal. Where is the nucleus of this cell? The nucleus is in the center. Cuboidal cells, the nucleus is in the center. And if you see one cell, अगर एक cell देखते हो आप, one moment, let me finish this. If you see one cell like this, the nucleus is in the center, you have an apical eosinophilic stain and a basal basophilic stain. Now this is something that you should know. This you have to know. So apical eosinophilia and basal basophilia, this is because of what? Can anyone tell me? This apical eosinophilic stain and the basal basophilic stain is due to the presence of zymogen granules. So zymogen granules. So the moment you look in the slide, you find such cuboidal cells, a central lumen, and this acinus is very brightly stained. Why? Because of the zymogen granules. Yes, very good. Apical eosinophilic stain, basal basophilic stain. So this is a colorful slide, right? So this is a serous acinus. Let me just tell you this, then we'll identify the slide. Okay, so that's a serous acinus. As compared to this, if you see this acinus has got tall and columnar cells. And where is the nucleus, bacha? The nucleus is flattened. The nucleus is at the base of the cell. Look, the nucleus is at the base of the cell. And what does this cell secrete? It secretes mucus, right? It secretes mucus. And what happens to the mucus during staining? Can anyone tell me what happens to the mucus while staining? The mucus dissolves. While staining. So this acinus looks empty. Empty दिखता है. This acinus looks empty. Or this acinus, the cells are disrupted. मतलब ना, the cells are disrupted like this. This acinus looks empty, the cells are disrupted. This is what we call as a moth-eaten appearance. Moth-eaten appearance, right? So the mucus dissolves during staining. So this is a mucus acinus, and this gland is known as a mucus salivary gland. Mucus salivary gland. This gland generally, this acinus generally looks lightly stained. Okay, just have a look at this now. Look at this slide, bacha. Can you see two acinus here? This is one type of acinus, and this is the other type of acinus. Okay, tell me what is number 1 and what is number 2. What is number 1? You can see a beautiful colorful slide. Cuboidal cells, nucleus rounded in the center of the cell. So what is number 1? Yes, what is number 1? What acinus is that? That's a serous acinus. Very good. That's a serous acinus. And what is number 2? Number 2, can you see this acinus? It looks empty. The cells looks empty. The mucus which is dissolved during staining. So this is a mucus acinus. So what do you call this gland as? Mucus acinus bhi hai, serous acinus bhi hai. So this gland is a mixed salivary gland. Okay, so this is a mixed salivary gland. Are you clear? So one is serous acinus, number 2 is mucus acinus. So this gland is a mixed salivary gland. And what happens? The gland will have a capsule. The capsule will send septa, which divides the glands into lobules. Can you see this? This is one lobule here. That's a second lobule here. So there are different lobules, and each lobule will have acinus. If it's a serous acinus, that is a purely serous salivary gland. Can anyone tell me what is the example of a serous salivary gland? Yes, sir, पूछते हैं बच्चों. This all things are asked in the exam, so be very clear about this. Example of a serous salivary gland. Any guesses? बोलो बच्चों. Example of a serous salivary gland. Submandibular नहीं है. नहीं. Serous salivary gland is parotid gland. Serous salivary gland is parotid gland. Example of a mucus salivary gland. Very good. Serous salivary gland is parotid. Mucus salivary gland example is sublingual gland. Sublingual gland is a mucus gland, and mixed is the submandibular gland. Mixed is a submandibular gland. So the moment you look into the microscope, you find acinus. The examiner is going to ask you the definition of acinus. So it's a group of cell which encloses a lumen, secretory cells enclosing a lumen. Then how to differentiate a mucus from a serous acinus? What are zymogen granules? And examples of mucus and serous salivary glands. Perfect? Okay. Very good. Now, sometimes a mixed salivary gland, what do you get? You get this mucus acinus like this, mucus acinus, and you might get different separate serous acinus, or sometimes the serous acinus is sitting over the mucus acinus. The serous acinus is sitting over the mucus acinus. Look, this is a mucus acinus and that's a serous acinus. The serous acinus is sitting over the mucus acinus like a small child is sitting on the shoulders. So what is this structure known as? This structure is known as, any guesses? Bacha, what is this structure known as? This is what we call as a demilune. So this is what we call as a demilune. And demilune, very good, serous demilune. And demilunes are characteristic of mixed salivary gland. But if it's a mixed gland, I might get serous acinus separate, mucus acinus separate, or I might get demilunes. See, beautiful slide. Can you see this demilune? Have a look at this. But have a look at this. This is a mucus acinus, and sitting on the mucus acinus is a serous acinus. Can you all appreciate this? So that's a demilune. So this is a purely mucus acinus. This is a purely serous acinus. Look, I'm writing it serous acinus. These are purely mucus acinus, and this are demilunes. I'm pointing it out for you. So these are the demilunes. Perfect. Clear to all of you? So can you identify a gland now? Serous, mucus, and mixed salivary gland. And what are these, bacha? What are these? What are these structures? Can anyone tell me what are these structures? What are these structures? A big lumen with a stratified cuboidal epithelium or a simple cuboidal epithelium? What would this be? Yes, answer this. What is this structure? I pointed it out. A large lumen, stratified cuboidal or simple cuboidal epithelium? This is a duct. Yes, interlobular duct. Yes, very good. It's a duct. And what could this structure be? Look at this structure. This structure, the epithelium is squamous. The epithelium is squamous and you've got a lumen here. Can anyone identify this structure? That's fine. That's an artery. Yes, very good. That's an artery. Excellent. Artery, okay. So you'll be getting artery, you'll be getting adipose tissue also. Look, beautiful. What are these structures? You can see adipose tissue. Adipose tissue dikhta bacha. This is the adipose tissue. See, in one slide you can see many things. And how does the adipose tissue look? Look. It looks like this. And the nucleus is pushed to the periphery, and the cytoplasm is seen as a rim like this. What is this known as? Good evening, bacha. Good evening. What is this known as? I have drawn a adipocyte for you. Adipocyte. So whatever is seen in the slide, I'm telling you. Adipocyte. What is this appearance known as? Signet ring appearance. Very good. Very nice. Signet ring. Ring hota na, diamond ring. So this is the diamond of the ring. The cytoplasm is pushed to the periphery. A thin rim of cytoplasm hota hai, and there's a vacuole in between. Okay, it is empty in between. So this is a fat droplet hota na. This is a fat droplet, and this fat droplet gets dissolved during staining, so it looks empty. The cytoplasm is seen as a thin rim, and the nucleus is at a periphery. So this is what we call as a signet ring appearance of adipocyte. Just remember this. In one slide, many things can be seen. The examiner can take the vibe on that slide and finish it off. Perfect. Now see, I get a serous salivary gland. Okay, just have a look at this. This, if I see this area, I find this are serous acinus. Okay, so I feel this is serous salivary gland, but on one side of this field, I find such structures like this in groups. I find these cells in groups. I'll show you the slide somewhere else. But what are these? These are the islets of Langerhans. Islets of Langerhans. So what is this? What is this slide? Matlab, serous acinus hai, and I get islets of Langerhans. So then that slide is going to be pancreas. Pancreas. Remember, pancreas is exocrine and endocrine. Barabar. The exocrine part of the pancreas resembles a serous salivary gland, and the endocrine part of the pancreas are islets of Langerhans. So, bahut baar hai na, many a times the bachche gets confused. The student gets confused. It's a slide of pancreas, but students fail to see the islets of Langerhans. What the student sees serous acinus, they identify it as a serous salivary gland. But if it's a slide for identification, 1 minute, the moment you look into the field, into the microscope, there has to be islets right in front of your eyes, plus serous acinus, identified as pancreas. Perfect? Okay, great. Very nice. Chalo, good. So that's about the salivary glands. Have a look at this, bacha. What is this? Can anyone guess this? The easiest slide on earth that anyone can get. What is this slide? The easiest slide. Histo is always scary, and a slide for discussion is more scary. Yes, this is a hyaline cartilage. This is a slide of hyaline cartilage. So let us understand, if a slide of cartilage comes, cartilage, So cartilage is having ground substance, and it will have cells. The cells are known as chondrocytes. Now cartilage are of three types. Just remember what I'm telling you. It is very easy. Cartilage are of three types. One is hyaline cartilage, elastic cartilage, and white fibrocartilage. Hyaline, elastic, and white fibrocartilage. Very good. Now what do I get in the hyaline cartilage? A perichondrium. Perichondrium is present in elastic cartilage, minus absent in white fibrocartilage. So perichondrium is present in hyaline, present in yellow elastic cartilage. It is absent in white fibrocartilage. Okay, chondrocytes. How are the chondrocytes in hyaline cartilage? In hyaline cartilage, the chondrocytes are found in groups like this. Look, this is 1, this is 2, this is 3, and this is 4. The chondrocytes are found in groups. What do you call this as? Anyone? What do you call this as? This is what we call as the cell nest. Cell nest. Just remember this. Well, hyaline cartilage, if I'm seeing, I find the perichondrium, and as I come inside the slide, I find chondrocytes in a group. And what do you call this group as? Cell nest. Cell nest, bacha. nest. This is in group. So this cell nest is a characteristic of hyaline cartilage. What about chondrocytes and elastic cartilage? Large size of chondrocytes. Chondrocytes are largest in size. The largest size of chondrocytes are seen in yellow elastic cartilage. That's an MCQ. And in white fibrocartilage, the chondrocytes are small in size. Small in size. Okay, these are very small in size because plenty of collagen fibers are present in white fibrocartilage, and because of plenty of collagen fiber, the chondrocytes becomes very small in size. What about the fibers? Or what about the fibers? What do you get here? Elastic fibers. And what do you get here? You get collagen fibers. Okay, collagen fibers. Now you tell me, how does an elastic fiber look? The moment you say elastic fibers are seen, chondrocytes are large in size, perichondrium is present, that has to be an elastic cartilage. So suppose if I have to focus a slide of elastic cartilage, what will I focus? A capsule and perichondrium. Then I would focus an elastic fiber, and I would focus a chondrocyte. How does an elastic fiber look? Like, see, when you're looking in the microscope, you'll always move the fine adjustment, right? Fine adjustment. When you move the fine adjustment, something comes, shines and goes back. Shines and fades away. These are elastic fibers. Elastic fibers are single, they are branched, and they shine. Those are elastic fibers. Whereas collagen fibers are in a group. There are bundles of collagen fibers. They don't branch. Okay, so collagen fibers are present and here. And how is the ground substance here? The matrix is amorphous and ground glass appearance, right? Ground glass appearance. Okay, right? So matrix is amorphous, homogeneous, ground glass appearance. इसमें elastic fibers, इसमें collagen fibers. Tell me examples. Examples of hyaline cartilage. चलो बोलो बच्चों. This you should know. This comes as an MCQ. This is asked in the vivas also. Yes, translucent. Very good. Very good, Vinay. Example of hyaline cartilage. Thyroid, cricoid, trachea. Thyroid, cricoid, trachea. These are all examples of hyaline cartilage. Elastic cartilage is pinna, epiglottis. Pinna, epiglottis. Very good. And what about white fibrocartilage? White fibrocartilage is intervertebral disc, right? Intervertebral disc, menisci, articular disc. These are example of white fibrocartilage. बस इतना याद रखना बच्चों. This is what is expected from you. Epiphyseal plate. Yes, epiphyseal plate is an example of hyaline cartilage. Yes, Krutharth. Yes, okay, fine. But this concept, tell me now. Look at this slide. You can see this perichondrium. Yes, this here is the perichondrium. These are the chondrocytes. You can see this chondrocytes in group. What do we call this? A cell nest. And the matrix is ground glass appearance. It is, right? So this is a hyaline cartilage. Examples you know. Coming to this, look at this. This is the perichondrium which is present here. You can see large chondrocytes here. Chondrocytes are very large in size. And you can see these fibers. These are the elastic fibers. Elastic fibers. So this is a slide of elastic cartilage. But so this, I mean, you have to keep on seeing the slides. Huh? And this much, even if you write with a beautiful diagram, that is enough. And see, look at this slide. You can see this chondrocytes are very small in size. What are these? These are the collagen fibers. Collagen fibers, perichondrium is absent. Perfect. So cartilage you will be able to identify. Fine. Perfect. Okay, now can anyone tell me what is this slide? Chalo, bacho, what is this slide? Another very important thing, because this general histology keeps on coming everywhere in systemic. Answer this. What is this slide of? Very good to all of you. Yes, bacho, what is this? These are longitudinal muscle fibers here. These are the muscle fibers, and where's the nucleus? The nucleus is at the periphery. Very good. The nucleus is at the periphery. So what is this? A slide of skeletal muscle. This is LS of a skeletal muscle. Very good. Dekho, general histology will be there. Huh? So Muscle is generally kept in the exam. So this longitudinal fibers, you will see striations. Striations are present. Nucleus is at the periphery. So this is LS of a skeletal muscle. If you see this, what is this going to be? This is TS of a skeletal muscle. Again, striations are seen. Nucleus is at the periphery. You can see this nucleus at the periphery. So this is a TS of a skeletal muscle. Yes, yes. Fine. Now, if you compare this, can you tell this? Look, what is this that I'm pointing to? What is this that I'm pointing to? And what is this that I'm pointing to? The longitudinal muscle fibers are seen. What is this number 1? Between two muscle fibers, between two cells, there is something here. What is that something? This is cardiac muscle. That's an intercalated disc. So number 1 kya hai? Number 1 is an intercalated disc. You can see beautiful intercalated disc everywhere. Look, that's an intercalated disc. That's an intercalated disc. And what is number 2? Number 2? Number 2 is branching. Snehajit, yes. Number 2 is branching. You can see branching. So if it's a cardiac muscle, what do you see? Longitudinal muscle fibers present. Branching is seen, intercalated disc are seen, and the nucleus is in the center of the cell. Look at that, the nucleus is in the center of the cell. Okay, if you see the PW app, I've talked about this in details. Fine. Clear to all of you? So that's a cardiac muscle, LS of a cardiac muscle. Okay, what is this? You do not get a separate slide of smooth muscle. Smooth muscle ka separate slide nahi hota because smooth muscle always comes with the viscera. So whenever there's a viscera, a stomach, esophagus, anything, there's going to be smooth muscle. What is the shape of a smooth muscle? It is spindle shaped like this, spindle shaped, and the nucleus is in the center. Spindle shaped, nucleus is in the center. But remember, bacha, smooth muscle slide generally is not kept in the exam. It would be skeletal muscle, it would be cardiac muscle. If there's a deficiency of slide, yeah, they might keep. Fine. Smooth muscle is found in the viscera, visceral organs. Fine. Now coming to this very, very important tissue, that's a lymphoid tissue. Okay. Just try to understand this. One slide of lymphoid tissue is always going to be there for you. Lymphoid tissue. This details I've explained in the app. I'm just telling you the points of identification. Lymphoid tissue, the moment I look into the slide, I find this rounded structures. What do you call this as? What do you call this as? Lymphoid follicles. Lymphoid follicles. And this lymphoid follicles in the center are lightly stained. What is that known as? Lymphoid follicles in the center, they are lightly stained. What is that known as? Germinal center. Germinal center. So that's a lymphoid follicle or lymphatic nodule in the center. That's a germinal center. So lymphoid follicles. एक बच्चा एक मिनट बोल रहा हूँ. Lymphoid follicles. Okay, just have a look. Present. Lymphoid follicles present and lymphoid follicles absent. Just remember what I'm telling you. This is a very simplified way. So lymphoid follicles are absent. The moment lymphoid follicles are absent, but yes, you find a basophilic stained slide. What is the slide going to be? Which is the lymphoid tissue in which the lymphoid follicles are absent? Come on, bacha. Can you tell me this? Which is the slide of lymphoid tissue in which the lymphoid follicles are absent? Any guesses? That's thymus. Remember, thymus. Very good, Vinay. Very good, bacha. So that's thymus. The moment lymphoid follicles are absent, I'm 100% sure this is thymus. But yes, it's a slide of lymphoid tissue. Now, how do I confirm this as thymus? What do I find? Capsule. And this capsule will send septa, which divides the thymus into lobules. So there are thymic lobules here. Ritvi, अरे बच्चा ritvi, वो white pulp and red pulp है ना, तो white pulp is a lymphoid follicle in spleen. In spleen, जो white pulp है ना, that itself is a lymphoid follicle. We'll come to this. Yes, Anand. Hi, Anand. Hi. Okay. So capsule है, the capsule will send septa. I'll show you the slide. I'll show you. बस ये theory समझ लो. The capsule will send septa, and this septa will divide the thymus into lobules. Now, each lobule will have a cortex. Each lobule will have a cortex. and a medulla. Just one moment. Each lobule will have a cortex and a medulla. And what is present in the medulla? The medulla will have Hassel's corpuscles. The medulla will have Hassel's corpuscles. Just one moment. Again, now there's some problem always there. The Hassel's corpuscles are characteristic of what? Thymus. Just one moment. Am I audible? Okay, our voice is again starting to cut. The voice is there, no? Or the voice. Just one moment. Have a look at this slide. है ना, बीच में ही हैंग हो जाता है. That is the problem. Okay, just 2 minutes. Wait. By this time it will start. Give me 2 minutes. Okay, look here. Lymphoid tissue, you get lymphoid follicles. There are four lymphoid tissue. One is lymph node, spleen, tonsil, and thymus. Lymph node, spleen, tonsil, and thymus. Out of this, lymphoid follicles are absent in thymus. Okay, just wait, I'm telling you. Lymphoid follicles are absent in thymus. So how do we confirm this is thymus? We have a capsule. The capsule will send septa, which divides the thymus into lobules. Each lobule will have an outer cortex and an inner medulla. And what is present within the medulla? The medulla contains rounded structures which are known as Hassel's corpuscles. So Hassel's corpuscles are characteristic of thymus, right? Hassel's corpuscles are characteristic of thymus. Just one moment. It's hanged. थोड़ा हैंग हो गया. Okay, look at this slide. Look at this slide. Look at this slide. You can see this. What is this now? That's a thymic lobule. Look at this slide. So this is a thymic lobule. That's a thymic lobule, right? There's some, this is hanged up. So I'm just trying to explain you. That's a thymic lobule. What is this outside? This is the cortex. Look at this. This outer thing is the cortex here. And what is this here? That's a medulla here. That's a medulla. And what is this medulla contain? What is this here? That's a Hassel's corpuscle. Hassel's corpuscle. Is it clear? This thing, is it clear? Fine. Fine to all of you. Okay. Thymus clear है बच्चों? Okay. Now this is started. Fine. Started. Okay. Clear. Now thymus is clear. Okay, fine. Now lymphoid follicles are present. Suppose if lymphoid follicles are present, what could it be? Lymphoid follicles are present, matlab it could be a lymph node, it could be spleen, or it could be a tonsil. The moment lymphoid follicles are seen, thymus is out. So what could it be? It could be a lymph node. क्या स्नेहजित Wait, I'll tell you. So if lymphoid follicles are present, it would be lymph node, spleen or tonsil. Now how do you identify a lymph node? Lymph node में एक capsule होगा, capsule, and below the capsule there's a space. Just below the capsule there's a space. What is that known as? A subcapsular sinus. Subcapsular sinus. Then there's a cortex and a medulla. Cortex and medulla, and lymphoid follicles are present in the cortex. Lymphoid follicles are present in the cortex. Clear to all of you? So lymphoid follicles are present. It could be lymph node, spleen or tonsils. How do you identify lymph node? Suppose if I have to focus a lymph node for the students to identify, I'll first focus the capsule. Capsule के नीचे एक space होता है. What is that space? Known as subcapsular sinus. Right, and then below that we get cortex and medulla. The cortex contains lymphoid follicles. The medulla contains medullary cords and medullary sinuses. Medullary cords and medullary sinuses. Okay. अरे lymphoid follicles absent है, but वो है ना, those cells are there, no, they are not in the form of a follicle, right? But cells are there, so it would look basophilic, no? Fine. What is the characteristic of spleen? Spleen में क्या होता है? Red pulp and white pulp. Red pulp and white pulp. White pulp is nothing but a lymphoid follicle. White pulp is nothing but a lymphoid follicle. Okay, and inside this white pulp, look, अगर ये white pulp है, this lymphoid follicle is known as the white pulp, and inside this white pulp there is a small arteriole which is pushed to the periphery. What do you call this as? I'll show you this. मैं दिखाता हूँ. I'll show you this. Just tell me, what is this known as? So spleen, I get a capsule. The capsule will send septa. Inside the spleen, we get red pulp and white pulp. The white pulp itself is the lymphoid follicle. And inside this lymphoid follicle, we find a small arteriole which is pushed to the periphery. It's not in the center. What do you call this as? Very good, very good. Krutarth matre. Yes, very good. This is known as eccentric arteriole. Krutarth matre. MGM. MGM. Okay. I was just recollecting your name. Okay, so eccentric arteriole, that is a characteristic of lymph node. That's a characteristic of spleen. Now coming to the tonsil. How do you identify tonsil? Tonsil may you get such depressions like this. Depressions. What are these known as? Crypts. These are the crypts. What is the lining epithelium of the tonsil? It's oral epithelium. Oral epithelium. Matlab it is stratified, squamous, non-keratinized. Right? So epithelium is stratified, squamous, non-keratinized. Stratified, squamous, non-keratinized. We get crypts. Tonsillar crypts. Okay. Yeah, stratified, squamous, non-keratinized epithelium and tonsillar crypts are present. Lymphoid follicles are seen. Fine, with this background, just have a look at this now. But can you tell me what is this slide? Come on. Lymphoid follicles दिखता है, देखो. This is a lymphoid follicle. Thymus में lymphoid follicles are not there, but lymphocytes are there. No, the cells are there, so it would look blue in color, right? So these are the lymphoid follicles. Yes. Suppose if I have to focus this, I would focus on this. What is this? Number 1. That's a capsule. What is this? Number 2. That's a subcapsular sinus. What is this? Number 3. That's a cortex. And this number 4 is the medulla. What does the cortex contain? Lymphoid follicles, right? It contains lymphoid follicles. All the afferent lymphatics, will come and open into the subcapsular sinus. The lymph is filtered in the subcapsular sinus, and the filtered lymph will be passing through the medullary cords, the medullary sinuses, and it would go out through the efferent lymphatics. Clear? So this is a lymph node. Clear है बच्चों? See, I'll focus only this much part. पूरा तो नहीं आता ना field में. The entire slide will not be seen. So what do I focus? Capsule, a subcapsular sinus, and the lymphoid follicle. These 3 things, the moment you look in the field, lymph node. Perfect. Okay, great. Now you tell me, what is this? The beautiful slide. That's a beautiful slide. So what is this? That's a crypt. You can see lymphoid follicles. And what is this epithelium here? The epithelium is going to be stratified, squamous, non-keratinized. So moment I see lymphoid follicles, it could be tonsil, lymph node, or spleen. The moment I see this crypts, the moment I see a stratified squamous keratinized non-keratinized epithelium, it is tonsil, palatine tonsil. Okay. And what is this? Look, this is beautiful. What are these? These are the lymphoid follicles. Look, 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 look. These are the lymphoid follicles, and this lymphoid follicles is nothing but white pulp. And what is all this? This is the red pulp. That's a blood filled, that's red pulp. And inside this lymphoid follicle, you find an arteriole which is pushed to the periphery. That's an eccentric arteriole. Eccentric arteriole. Ah, yes, 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 Nehajit, yes. Clear? Lymphoid tissue by default, one slide is going to be there. And bacha, if you are identifying a slide, no two slides will be of the same system. Huh? Remember this. Matlab na, what students do, slide number 1 spleen, slide number 3 lymph node. Lymphoid tissue ka ek hi slide rahega. Muscle, only one slide will be there. Cartilage, only one slide will be there. You understand? So if you are finding similarity, you should know there's something wrong in your identification. Right? Fine. Perfect. Good, good, good. Chalo, good, good. Coming to this slide. Chalo. Before that, tell me, bacha, what are the layers of GIT? Okay, layers of GIT. This is a very common question which is asked. Layers of GIT. One is mucosa, submucosa, muscularis externa, and the last one is serosa. Okay, mucosa, submucosa, muscularis externa, serosa. Any slide of GIT you get, this is a standard question by the examiner, right? Ah, very good. So what are the parts of mucosa? Mucosa mein epithelium, lamina propria, and what is the third one? Muscularis mucosa. So epithelium, lamina propria, and muscularis mucosa. Now this muscularis mucosa is a characteristic of GIT. Remember, this muscularis mucosa is present throughout the GIT. Okay, so that is muscularis mucosa. The next is submucosa. This submucosa generally contains glands. Submucosa contains glands. Then is muscularis externa. Muscularis externa contains outer longitudinal muscles and inner circular muscles, right? Outer longitudinal, inner circular muscles. And last is serosa or adventitia. Bas, ye yaad rakhna hai. This is a standard thing which will be asked. Even if a slide of GIT comes as describe stomach or describe esophagus, you are going to write as layers. Mucosa, submucosa, muscularis externa, serosa. Mucosa is made up of epithelium, lamina propria, and muscularis mucosa. Then submucosa, muscularis externa, outer longitudinal, inner circular, and serosa or adventitia. Okay. Can anyone tell me what is this slide of? Chalo, start. Yes, what is this slide of? Come on, answer this. Yeah, na, sometimes है ना बच्चे क्या करते हैं ना, they just look at this and they write it as skeletal muscle. They write it as skeletal muscle. Fine, skeletal muscles are there. Skeletal muscles तो है ही ना tongue में skeletal muscles are there. But just see this beautiful thing. What are these? These are the papillae. And you get a large papillae like this, which has got a trench here. And there are taste buds here, What is this largest papillae? That's a circumvallate papillae. Yes, circumvallate papillae. Vermilion border of lip nahi hai bacha ye. Immature scalpel. Vermilion border of lip nahi hai. So this is skeletal muscle. These are the papillae. Baki details of papillae are not asked. Only one circumvallate papillae can be kept as a separate slide. Filiform, fungiform, foliate, you can just tell that. Circumvallate papillae are large in size. Okay. Now you tell me what are these? Ye kya hai? What are these structures? What are these structures? Yes, anyone? What are these structures? That's okay, bacha. That's okay. Don't say sorry. That's okay. It's a process of learning. You always try to learn things. That's okay. What is this? These are the glands. These are the glands. You can see this glands here. Serous and mucous glands. What do you call this as? Von Ebner's gland. Von Ebner's gland. Where's Krutharth? Matre? Where are you? Okay, so this is a slide of tongue. Stratified squamous keratinized epithelium, different types of papillae are seen, skeletal muscles are seen, and von Ebner's glands are seen. That's a serous mucous glands. Okay, very good. That's a slide of tongue. But so this is a beautiful slide. Beautiful slide. What is this? Can anyone tell me? So this is a slide of GIT for 100% sure. I know this is a slide of GIT. Why? Because the layers of GIT are seen. What is this? This is the epithelium. And can anyone tell me what is this type of epithelium? You can see multi-layered. Ye dekho, many nucleus are seen. So it is a stratified epithelium. Stratified epithelium, बहुत सारे layers हैं, बहुत सारे nucleus दिखते हैं. You find plenty of nucleus, and you find the topmost cells are flat. The topmost nuclei are flattened. This is squamous. So it is stratified squamous. And if there's a layer of keratin like this, so it is stratified squamous keratinized. But this, no keratin, so this is stratified squamous non-keratinized epithelium, right? So this is stratified squamous non-keratinized epithelium. Perfect. Very good. And what is this? What is this that I'm pointing? Can anyone tell me what is this structure that I'm pointing? Ye kya hai? Ye. What is this structure that I'm pointing? Look, this is a characteristic of GIT. What is this that I'm pointing? Stratified squamous non-keratinized epithelium. Stratified squamous non-keratinized epithelium. Fine. That's a muscularis mucosa. Very good, Snehajit. Ye muscularis mucosa. The arrows which I've pointed is muscularis mucosa. These are muscles only. Muscles hi hote hai. Muscularis mucosa. Now, what is the characteristic of esophagus? Bacha, what is the characteristic? Matlab, I'm looking in the slide, I find a stratified squamous non-keratinized epithelium, and I find this glands here. These are the mucus acinus. These are the mucus glands. Mucus glands. The moment I find this mucus glands in the submucosa, I find a stratified squamous non-keratinized epithelium. The rest of the layers are same. This has to be esophagus. Mucus gland. So glands in the submucosa, stratified squamous non-keratinized epithelium. This is going to be esophagus. What is this? Can anyone tell me what are these? What are these? Again, what is that? Beautiful, no? I mean, बहुत सारे दिखते हैं ये. What is this that I pointed? Any guesses? These are adipocytes, adipose tissue, adipose ebo. Adipose tissue above. The same signet ring appearance you can see. I magnified it. Look, you can see beautiful signet ring appearance. That's adipocyte. And these are blood vessels. As in one slide, you'll be able to see plenty of things. Adipose tissue, blood vessels. Like this is a blood vessel. Inner circular, outer longitudinal muscles. Perfect. What is this? A beautiful slide. The moment I look into the slide, it's a very colorful slide. I find the epithelium is simple columnar epithelium. Simple columnar epithelium. What is this? What is this known as? Like this, like this. This is known as the gastric pits. Gastric pits. Now the gastric pits in this is the stomach fundus. Fundus. The gastric pits in the fundus are less deep. Less deep. If you see the gastric pits in the pylorus, look. The gastric pits in the pylorus are very deep. You can see these deep pits. So the gastric pits in the pylorus are very deep. The gastric pits in the fundus are not so deep. And what does the gastric pit contain? Gastric glands. And the gastric glands in the fundus contains chief cells and parietal cells. Chief cells and parietal cells. Clear? So gastric pits less deep. The gastric glands contains chief cells and parietal cells. You can see this red and blue cells. These are the chief cells and parietal cells, right? Okay, fine. As if compared to this, the gastric pits are deeper. This is a less of a colorful slide, not much colorful slide as compared to fundus. Yes. Now you tell me, how do you identify a slide of small intestine? Small intestine. The moment I find a villus, the moment I find a villus, नहीं वो chief cells and parietal वो cells है वो हाँ those dotted blue are zymogen granules. Yes. So you tell me villus. What the moment I see villus, this is a slide of small intestine. एक मिनट Snehajit, I'll tell you. The moment we find villus is a characteristic of small intestine. Now you tell me. So it could be duodenum, it could be jejunum, or it could be ileum. How do you identify this? Chalo. Can anyone tell me? Tongue like, finger like, that's fine. But what is the main characteristic? The moment you see finger like projection, that's villus, right? So, villus with submucosal glands. Submucosal glands. What is this known as? Brunner's glands. Submucosal glands are known as Brunner's glands. So the moment I find a villus, I find mucus, the submucosal gland. What is that? That's duodenum. In the submucosa, I find glands. In the submucosa, if I find lymphoid follicles, in the submucosa, what is this known as? Pairs patches. It is ileum. And if there is nothing specific here, nothing specific in the submucosa, so that's going to be jejunum, right? That's going to be jejunum. So look, the moment I find a finger-like projections, that's villus. So I find the submucosa. Submucosa mein, if I see glands, that's duodenum. If I see lymphoid follicles, pairs patches, that's ileum. And I don't see glands, I don't see lymphoid follicles, that is going to be a jejunum. Perfect. Have a look at this. Look, this is beautiful. This is beautiful. What is this? These are finger-like projection. These are the villus. You'll get cut villus also. Ye villus in cut form also. And I focus on this. What is this? Bacha, what is this? These are the submucosal glands. Okay, clear? Tongue-like villi, that's fine. Tongue-like. Okay. Srimati. Yes. So this is duodenum, bacha. This is duodenum. This is duodenum. Now, if I find this, look at this. Leaf-like. Isko bolte hai leaf-like. And what are these? These are lymphoid follicles. These are pairs patches. So this is going to be. But goblet cells are present. Goblet cells are present in small intestines. Goblet cells are there in small intestines. That's fine. This is ileum. And if I find a structure like this, look. In the submucosa, there's no lymphoid follicles, no glands. So this is jejunum. Clear hai, bacha? I'm not going to details of it. I'm just telling you the points of identification, how to identify the slide. Okay, clear to all of you? So esophagus is clear, stomach is clear, the villus are seen. So that is intestine, small intestine. And can anyone tell me this slide? Look. What is this? The moment I look into the slide, I find empty spaces. Empty spaces meaning these are goblet cells. I find plenty of goblet cells. D-floor cell, yes, but D-floor is the best atlas. Vetus, some slides are from Vetus also. Yes, can anyone tell me what is this? This empty cells are the goblet cells, and I find plenty of goblet cells. This is colon, large intestine. This is the slide of colon or large intestine. So plenty of goblet cells for lubrication. Yes, clear to all of you? And I find plenty of goblet cells with lymphoid follicles in that. I find plenty of goblet cells. I know this is a slide of colon. Plus I find lymphoid follicles in it. What is this? Any guesses? Any guesses? What is this? Appendix. This is appendix. So lymphoid follicles hai, villus hai, that is ileum. Lymphoid follicles hai, plenty of goblet cells hai. It's a slide of appendix, right? So be clear about all this. Very good, very good, very good to all of you. Look, there are certain slides which are very easy. Matlab, see, if I'm an examiner and if I have to set the slides, I'll set the slides in such a way that out of 10 slides for spots, 5 are going to be very easy. Very easy, matlab, the moment you look into the slide, you will be able to identify the slide. Very easy slide. You should be able to identify them. And 5 spots are going to be difficult where you really have to think. So passing is easy, scoring is difficult. Okay, that's how it is going to be. The exams are like that. Okay, chalo, tell me what is this slide of? The moment you get this shaped structure, what is this? This is a hepatic lobule. This is a hepatic lobule. So this is a slide of liver. What is this? Number one, that's a central vein. And what is this? Number 2 here, that's a portal triad containing hepatic artery, portal vein, bile duct. And what are these cells? What are these cells? These are the hepatocytes. The hepatocytes are arranged in cord-like structures. Okay, these are the cords of hepatocytes like this. And between the hepatocytes, what are these spaces known as? What are these spaces between the hepatocytes known as? Sinusoids. So you get a hepatic lobule. In the center, you find the central vein. At the periphery, you get triads. Okay, portal triads. Hepatocytes are arranged in cord-like manner, and in between the hepatocyte there are sinusoids. In the sinusoids you get cells. What are these cells known as? What are those cells? Those are phagocytic cells. What are these? What are those cells known as? Kupffer cells. Kupffer cells. In the perisinusoidal space you get this Kupffer cells. What is the capsule of the liver known as? Gleason's capsule. Gleason's capsule. Okay, so liver is a very easy slide to identify. Yes, Joe, can anyone tell me what is this slide? Come on, let me see now. I've told you this slide earlier. Yes, very good, very good. What is this slide of? Any guesses, students? I've already told you the slide. Yes, Srimati. Very good. This is, see, generally kya hota hai na, students see only this area they see only this area, and yes, these are serous acini. These are serous acinas. The student write this as a serous salivary gland, but the students don't see this. What are these? Islets of Langerhans. So if it's a slide of pancreas, islets of Langerhans would be there right in front of your eyes. Just try to identify that. Plus you get serous acinus. So this is a slide of pancreas. Exocrine part is serous salivary gland. Endocrine part is islets of Langerhans. Clear? Baki alpha, beta cells and all that you can go through. Can anyone tell me what is this? Yes. What is this slide of? Student hai na, kya karte hai na, they see this and they write it as hyaline cartilage. This is a slide of hyaline cartilage. If you write it as a slide of hyaline cartilage, you don't get marks. But if the examiner is a good examiner, he might give you half a mark. So this is hyaline cartilage. Very good. These are the glands here. Yes, these are the glands here. And what is this? Epithelium. And you can find a muscle here, trachealis. Trachealis muscle. And what is the epithelium of respiratory epithelium? Anyone? What is respiratory epithelium? It is pseudo stratified ciliated columnar with goblet cell. You should be able to identify this. It is pseudo-stratified ciliated columnar with goblet cells. Pseudo-stratified ciliated columnar with goblet cell. That's your complete answer. So this is a slide of trachea. How do I know this? The epithelium is pseudo-stratified ciliated columnar with goblet cells. I find the hyaline cartilage. Yes, I see mucosal glands here, and sometimes you can see this muscle trachealis also. So this is a slide of trachea. Okay, this is another very easy slide. If you get this slide, you're 100% sure. You get empty spaces here. These are the alveolus here. What is the lining of alveolus? It is simple Squamous epithelium, exchange of gases here. Clear? Lungs. Lungs. Yes. Chalo bachcho, can anyone tell me what is this slide of? वो सब दिया है ऐप में. I've given everything in the app. Just have a look at this. Let me finish this. Najit. Okay. What is this? Yes, yes. That's fine. Tertiary, respiratory, terminal, bronchial. What is this? This is a slide of testis. So what is this one single structure that I pointed out? That's the seminiferous tubule. Seminiferous tubule. So you get seminiferous tubule, you get different stages of developing sperm. The moment you get the slide, spermatogenesis is always asked. वो सब पढ़ के जाना, spermatogenesis and all. Just go through it. Right? Then what is the function of Sertoli cells? What is interstitial cells of Leydig? What do they secrete? Testosterone. Sertoli cells are nourishing cells. All that thing is theory. So you can find the tails of the developing sperms in the center. Okay, so that's a slide of testis. Yes, any guesses? What is this slide? What is this slide? Any guesses? So then later we'll discuss slides with lumen. जो भी slides है, circular slide with lumen in it. This is one of them. Circular slide with a lumen in it. What is this slide of? But इसमें ना you get a very large muscle layer. Large muscle layer. So this is longitudinal, circular, again longitudinal. Longitudinal, circular, longitudinal muscle and a very small lumen. The epithelium is again pseudostratified, ciliated. What is this? Vast difference. Vast difference. A very small lumen and a thick muscle coat. Remember, circular slide with lumen, one is vast difference. Or we have, we'll come to this. So vast difference. Okay, fine. What is this slide of? Any guess? What is this slide of? This slide, no, students are not able to identify this slide. Bachcho, students are not able to identify this slide. Can anyone tell me what is this slide of? Just one moment. Yes, any guesses? Okay, I'm not able to see your comments. Yeah, that's prostate. That's prostate. How do you know this is prostate, bacha? Prostate is one difficult slide to identify. But, you know, how do you identify it as prostate? What are these glands? Look, these are the prostatic glands and the glands are typically like this. The glands are like this, folded, folded, folded. The moment you see this folded, what is this known as? Involutions. Involutions. The moment you see involutions, haunted face. Yes, the moment you see this involutions like this, so this is a very characteristic of prostatic glands. It shows involutions, foldings like this. And inside this glands, you find this. What are these red things? Prostatic concretions. Yes, very good. Yes, these are known as prostatic concretions. Or what is this also known as? This is known as corpora amyloacea. Corpora amyloacea. Okay, so this is known as corpora amyloacea. You can see this. These are the various lobules. The capsule divides the prostate into various lobules. Each lobule will have this glands which are involuted, and the glands will have prostatic concretions, prostatic secretions. Corpora amyloacea. Fine. Yeah. So prostate. Try to identify the prostate also. Okay, bacha. This is another very easy slide. If you get a slide, I'm very happy. चलो ये क्या है बोलो. Very easy slide. Luck, ultimately it's luck. So this is the cortex, that's the medulla. This is cortex, that's the medulla. The cortex contains different stages of developing follicles. Different stages of developing follicles are seen in the cortex. The medulla contains what? Medulla contains blood vessels, nerves, and lymphatics. Blood vessels, nerves, and lymphatics. So that's present in the medulla. The cortex contains different stages of developing follicle. One, you might see a developed Graafian follicle also, right? What is the epithelium of the ovary? What is the epithelium lining this testis and ovary? Known as germinal epithelium. Germinal epithelium. And what is germinal epithelium? What is the type? Anyone? What is the type of it? Germinal epithelium. What is the type? Yes, very good. Type bolo. Germinal epithelium. What is the type? It is simple cuboidal. Simple cuboidal. Huh? Just remember. See, there are some very easy slides like hyaline cartilage and muscle hai, lymphoid tissue hai, lymphoid tissue. These slides will always be there in general, right? Esophagus hai. Liver is very easy slide. वैसे lung is an easy slide. Ovary is an easy slide. Very easy slide to identify, right? Yeah. Simple cuboidal epithelium. Cortex, medulla. What does the medulla contain? What does the cortex contain? You have to know. Yes, bachcho, this is another slide with a lumen. Come on, bachcho, can you identify this slide? A slide with a lumen, but the lumen is folded. The lumen is thrown into folds. It's folded. And if you see the epithelium is ciliated columnar. Ciliated columnar epithelium. What is that? A folded lumen. Lumen is thrown into folds. Epithelium is ciliated columnar. What is this slide of? Answer? You can guess. It's a circular slide with a lumen. एक था vast difference. ये है दूसरा fallopian tube. That's a fallopian tube. This is the fallopian tube. Okay, bachcho. This is fallopian tube. I'm not able to see your comments. Yes, very good. You've written Krutharth. Yes, very good. So, what is the epithelium lining of the fallopian tube? It is ciliated columnar and the mucosa is thrown into folds. The mucosa is folded. Huh, bacha? So, circular slide with the lumen, one can be vas deferens, second can be fallopian tube. Yaad rakhna. The third can be a blood vessel. Blood vessel I have to tell you. Blood vessel I have not told you. Fine. Okay. Now, what is this slide? You find plenty of muscles. Look, these are smooth muscles, and the glands are very small in size. If you compare with this, the glands are tortuous gland, corkscrew appearance, tortuous glands. Muscle are comparatively less. So this is the uterus. Very good. So what is this stage and what is this stage of the uterus? This is proliferative phase, and which is the other phase? Secretory phase. So this is going to be the proliferative phase, and the other phase is going to be the secretory phase. Right? Very good. Easy, eh? Plenty of muscles. Another plenty of muscles you find in a slide, that is the bladder. मतलब बहुत सारे muscles दिखते हैं. You see muscles and only muscles in two slides. One is the uterus, the second one is urinary bladder. But uterus may you find glands. Glands are small in size, so that is proliferative phase. Glands are corkscrew appearance, that's secretory phase. How do you identify bladder then? You see the epithelium, and the epithelium has to be transitional. So that is going to be urinary bladder. Okay. Another very easy slide. The moment I look into the slide, I find such structures here. This is the Bowman's capsule. Then there will be a cortex, the medulla. You have a PCT, DCT, the loop of Henle. Right. So this is a slide of kidney. The kidney is a very easy slide to identify. Then differences in PCT and DCT is asked. What is the difference in PCT and DCT? Can anyone tell me? Cuboidal epithelium दोनों में है. Cuboidal epithelium is there in both PCT and DCT. What is the difference? Answer. How is the epithelium in PCT? How is the epithelium in DCT? This is asked in the exams. Simple cuboidal with brush border. That's in PCT. Remember, simple cuboidal with brush border. That's in PCT. Without brush border in DCT. So what is the lining epithelium of PCT and DCT? Simple cuboidal. The loop of Henle is simple squamous epithelium. This all is asked. Yes, lumen is larger in DCT. Fine. Bacha, this is another slide that I was telling you. You get muscles and muscles. Plenty of muscle fibers, smooth muscles. So you get confused between uterus and bladder. So how do you know this is urinary bladder? The moment you find this epithelium, it's a stratified epithelium, and the topmost cells are umbrella shaped cells. Can you see this? See beautiful cells here. These are umbrella shaped cells. You can see this. You can see this cells, umbrella shaped cells. So this is the urinary bladder. Yes, Nejit, very good. Very good. Srimati, Ashutosh, Vinay, yes, everyone is answering very well. Very good, bacho, very good. You're all very well at histology. Remember, if you are a histologist, good, your pathology will be good in second year. Because all abnormal things, the first will come to histology. Okay, clear, smooth muscles, transitional epithelium. Bacho, there's one more circular slide with a lumen for you. What is this? So circular slide with lumen, number 1 is vas deferens, number 2 is fallopian tube, number 3 is here a beautiful star-shaped lumen with transitional epithelium. That's going to be the ureter. Ureter. Okay, so now clear. Circular slides with a lumen. एक है vas deferens, एक है fallopian tube, one is the ureter. How do you know it is ureter? It has got a star-shaped lumen. Epithelium is transitional. How do you know it is fallopian tube? The lumen is thrown into folds like this, and the epithelium is ciliated columnar. Vas deferens, the lumen is very small, and a thick muscle coat is seen. Thick muscle coat. ये सब पूछते हैं बच्चा. This is asked in the exams. What resembles to this slide, or this tissue may resembles to what? So you have to be well prepared with everything. Okay, very good. Very good. Chalo, coming to this group of slide, another extremely easy slide to identify. You get vesicles filled with colloid, and if you see the epithelium, it is simple cuboidal epithelium. Simple cuboidal epithelium. Yes, very good, very good. This is thyroid. A very easy slide to identify. Thyroid. If your luck is very good on that particular day, you will be able to identify the slides. Okay, but you're all good students. Luck is a different thing. Okay, you should know this. So that's thyroid. Colloid-filled vesicles. Okay, now you tell me what is this slide. You get a capsule here. Another difficult slide to identify. This is capsule. And then you will see the cortex. The cortex has 3 layers of cells. The first layer in which the cells are umbrella shaped like this. Umbrella shaped. So what is this? Zona glomerulosa. The second in which the cells are in the form of cords. Cords like this. Cords. What is this? Zona fasciculata. And the third, the cell will form a network like this. Network, that is zona reticularis. Reticularis. Right? So this is a slide of suprarenal gland, bacha. I might have another slide. Oh, this is a good slide. Beautiful slide. Exactly see like this only. But be fresh during the exams, bacha. If you're not able to identify a particular slide, just try to see what is seen there. So this is the cortex. This is the capsule here. And this is the cortex for you. This is the cortex. So you can see this umbrella shaped cells here. This is the zona glomerulosa. You can see cords of cells. Cords of cells. This is zona fasciculata. And here the cells are going to form a network. So that is zona reticularis. So that's the cortex of an adrenal gland. If you go further down, you'll see the medulla. And medulla contains chromaffin cells. Chromaffin cells are present in the medulla. Then what each layer secretes, just remember that. Glucocorticoids, mineralocorticoids, sex hormones. ये सब याद रखना. Fine, bachcho, clear to all of you? The adrenal gland. Yes, this is another slide. And you know what? But you know what you see? Some of the students just see this and they identify this as thyroid gland. But no, this is not thyroid gland. If you see here and there on this slide, you see nerve fibers, and here you see acidophils and basophils. Acidophils and basophils. The chromophils. So you see acidophils, basophils in front. You find nerve fibers behind, and you find colloid-filled vesicles in between. This is a slide of pituitary gland. But generally when it is focused, those colloid-filled vesicles are also focused. If I have to focus a pituitary gland, I have to show you all the 3 parts Pars anterior, pars posterior, and pars intermedia. So pars anterior contains acidophils, basophils, chromophobes, chromophils. Pars posterior contains nerve fibers, and pars intermedia will contain colloid-filled vesicles. But students just identify the colloid-filled vesicles and identify this as thyroid. No, this is not thyroid. This is a slide of pituitary gland. Neurohypophysis, adenohypophysis, yes. I'm just helping you to identify the slides. Lucky the details are there in the app also. But show, can you identify this slide? Come on, this is another very, very, very important slide for you. Yes. What is this slide of? Cells नहीं होते, no fibers are present, no fibers. Vinay, no fibers होते हैं वो. This is a slide of cerebellum. So what is this 1, this 2 and this 3? What is number 1? The first number 1 layer is what? Molecular layer. Molecular layer. What is this? Purkinje cell layer. And what is this? Granular layer. A very, very characteristic slider. If I have to focus a cerebellum, I have to show you one Purkinje cell for sure. Purkinje cell is a flower-shaped cell. So one is a molecular layer which contains nerve fibers. Then the Purkinje cell which has Purkinje cells which are flower-shaped cells. And the inner one is a granular layer which contains granule cell, Golgi cell. Okay. So what is the function of Purkinje cell? This is asked. The Purkinje cell are the sole motor output from the cerebellum. Otherwise, cerebellum is mainly sensory, right? It receives all sensory input. The only motor output from cerebellum is what? Purkinje cell. The only motor output from cerebellum is Purkinje cell. And what is this Purkinje cell going to inhibit? Bolo. What does this Purkinje cell do? It inhibits. Anyone? Inhibits what? The deep cerebellar and the lateral vestibular nucleus. Just remember one thing, the only motor output from the cerebellum is Purkinje cell, and this Purkinje cell is going to inhibit the deep cerebellar and the lateral vestibular nucleus. Deep cerebellar are those 4 nucleus of cerebellum, dentate, fastigiae, globus and emboliformis. And what are the 2 types of fibers which comes towards the cerebellum? One is the climbing fiber and one is the mossy fiber. Climbing fiber, mossy fiber. We'll see this in neuroanatomy later. Okay, fine. Now you tell me, what are the 3 tunics of an artery? I don't have that slide of artery. What are the 3 tunics of an artery? This is tunica intima, tunica media, and tunica adventitia. Okay, tunica intima, tunica media, and tunica adventitia. Tunica intima is made up of 3 parts. One is the epithelium. The second one is the subendothelium. What is the epithelium? What is endothelium? It is simple squamous epithelium which lines the blood vessels. That is endothelium. Second is subendothelial connective tissue, and the third one is internal elastic lamina. Internal elastic lamina. So endothelium, subendothelial connective tissue, and internal elastic lamina. Tunica media will contain muscular fibers or elastic fibers. Okay, internal elastic lamina is made up of what? Internal elastic lamina is made up of elastic fibers. Internal elastic lamina is made up of elastic fibers. First, if a slide of blood vessel comes, the examiner is going to ask you what are the layers of the blood vessel. So you say tunica intima, tunica media, tunica adventitia, right? Tunica intima is made up of endothelium, the subendothelial connective tissue, and internal elastic lamina, which is itself made up of elastic fibers. Tunica media. Now, arteries of 2 types. One is a muscular artery, muscular, and the other one is elastic artery. Muscular artery and elastic artery. Now, how do you identify muscular and elastic artery? The tunica media of a muscular artery contains large number of smooth muscles. Okay, this will contain smooth muscles and this will contain elastic fibers. The tunica media of an elastic artery contains large number of elastic fibers. Tunica media of a muscular artery contains muscular fibers. Okay, that's fine. You tell me what is the characteristic of a muscular artery. Come on, bacho. The question is open to you. The moment I look into the slide, I know 100% this is muscular artery. I see something there. What is the characteristic of muscular artery? Anyone? Anyone? Follow. What is the characteristic of muscular artery? Bolo bachcho. See, this is endothelium. This is subendothelial connective tissue. This is internal elastic lamina. Now, I draw this like this. So, this is tunica media. This is tunica intima. And this is tunica adventitia. Fine. Now, what is this? What is this wavy line? You tell me, what is this wavy line? This is the internal elastic lamina. Okay, this is internal elastic lamina, and this internal elastic lamina is a characteristic of, okay, tell me, this internal elastic lamina is a characteristic of which artery? But can anyone tell me? This internal elastic lamina is a peculiarity, it's a characteristic of muscular artery. It's a characteristic of muscular artery. Internal elastic lamina is a characteristic of muscular artery. Doesn't mean it is absent in elastic artery. No, it is there in elastic artery also. So what? But it is very prominent in muscular artery. Why, bacho? Why? Because muscular artery will contain what? Smooth muscles. Look, muscular artery will contain large number of smooth muscles. Smooth muscles. Dekho, I draw this as smooth muscles. So tunica media of a muscular artery contains smooth muscles, and this internal elastic lamina, which is made up of elastic fibers, stands out prominently between the smooth muscles. Okay, so internal elastic lamina is a characteristic of muscular artery. Doesn't mean it is absent in elastic artery. Elastic artery may be, internal elastic lamina is there, but tunica media of an elastic artery contains what? Elastic fibers. And tunica intima is also made up of elastic fibers, so it is cannot be differentiated. You're understanding this? Internal elastic lamina is present in both muscular as well as elastic artery, but it is well defined in muscular artery because tunica media of muscular artery contains smooth muscles. So, the internal elastic lamina, which is made up of elastic fibers, stands out very prominently in muscular artery. Now, what happens in elastic artery? Tunica media of elastic artery contains elastic fibers. So, this internal elastic lamina, which is made up of elastic fibers, merges with it, cannot be differentiated. So, clear, if the examiner is going to ask you what is the characteristic of muscular artery, your answer is internal elastic lamina is clearly seen. Fine, bacho, clear? You understood this? And what is you tell me, elastic artery is also known as what? Elastic artery is also known as conducting vessels. Elastic artery is known as conducting artery, whereas muscular artery is known as distributing artery. Just remember this, elastic artery is conducting artery and muscular artery is distributing artery. Now, what is vasa vasuram? Can anyone tell me what is vasa vasuram and what is nervi vasuram? This is asked in the exams. So, tunica adventitia contains vasa vasuram and nervi vasuram because blood vessels में muscles है ना, so muscles need blood supply. So, the blood vessels which supply blood vessels, there are small arteries which are present in the tunica adventitia. This is known as vasa vasuram. So, what is vasa vasuram? These are arteries supplying the arteries, and the nerve fibers which supply the arteries are known as nervi vasuram. So, vasa vasuram and nervi vasuram are present in tunica adventitia. So, clear hai bacha? Dekho, once again, artery, three parts: tunica intima, tunica media, tunica adventitia. Tunica intima contains endothelium, which is simple squamous epithelium, subendothelial connective tissue, and internal elastic lamina, which is made up of elastic fibers. Tunica media of a muscular artery contains smooth muscles, elastic artery contains elastic fibers, and tunica adventitia contains vasa vasorum and nervi vasorum. Clear to all of you? Is this clear? So this is about histology. I hope these things are clear to you. थोड़ा सा detail पढ़ लो. You can refer to the app. The notes are there in PW Med Ed app. You can refer to that. Okay. I hope things are clear to all of you. Next, then Tuesday we'll have a lecture on embryo. The important embryo topics, important from exam point of view, will revise. Okay, and then one neuroanatomy. Fine. Thank you, my dear children. Thank you to all of you for a very patient listening. Thank you. Thank you. Fine, बच्चों. Bye bye. ये ना बच्चों है ना आप लोग है ना बीच में this chat is not seen. Okay, thank you. We'll stop.